Hi, Dr. Shiller here, and I want to share a bit with you about how I approach patients who come in with pain so you can get an idea of whether my approach and my practice style is something you want to explore and if you want to come make a visit. Um, so, I'm going to talk about chronic pain in general and not specifically about fibromyalgia, although a lot of what I talk about is relevant to fibro. So if fibro is part of what you're dealing with, watch this video, but also look out for another one from me on that particular topic. So basically for around the last 25 years, a predominant part of what I've been doing is helping people with chronic pain, increasingly with an integrative and functional approach, because what I learned in Harvard Medical School didn't really capture the fullness of what's going on and what's driving pain and the suffering and disability of pain. So I looked outside the box and learned a lot about how to help people. And there's really two kinds of people who I feel like I've helped the most over the years. One kind is the person who has mainly gone a conventional medicine route and has done all the stuff that their doctors told them and comes to me saying, look, I've tried everything, there's nothing that helps me. But then we find something that helps them because we take a more integrative, holistic approach. The second kind is someone who has maybe been more open to conventional healing, but is kind of lost in the maze because there's so many different approaches. There's so many different things that they might get directed towards. And the question is it exactly what that patient needs? Because a lot of practitioners, they have their one thing that they do, and everyone comes in the door, and if you're a hammer, everything looks like a nail. And I'm not a hammer. I'm someone who's learned a really, really broad swath of all the different approaches, whether they be conventional, complementary. And what I try to do is really understand what's going on in that particular patient, what are their values, what are they after, and how can I help them? So let's unpack that a little bit because it might help you understand where I'm coming from and what to expect if you decide you want to come and see me. So let's try to understand, why does chronic pain happen? Because it's a disease. It's a process that develops over time. And the first thing I want you to know is that you've got a pain processing system. And suppose this is your hand and you get a burn or a wound or an infection, you got nerves, various kinds of nerves bring that pain signal to the spinal cord, and from there it goes up various pathways to different parts of your brain. And the key thing to know is that this pain processing system it's like an amplifier. There's multi-steps. There's these synapses where nerves talk to each other. They move in different pathways. And, in your brain is where your pain says, I've got burning in my hand. And in another part of your brain is the place where your brain says, I can't stand this. And so that is the experience of pain. And it happens with this complex processing that happens in the spine and the brain, and that is subject to amplification by lots of different factors. And these things are things that I didn't always get taught to think about in residency and medical school. These are things that can turn up the volume on pain. Sensitization in that peripheral nerve. As soon as you have pain, your nerve starts to change ion channels and all sorts of things that affect how sensitive and responsive it is. The area of pain can expand, and that's why you might notice, well, first it hurt here and now it's hurting my whole hand. And then there's other things we'll talk in a minute about why it might spread up your arm. But persistence of pain, there can be changes in your hormonal system, there can be inflammatory changes, neurotransmitters. Your negative emotions and beliefs can amplify your pain or turn your pain down. And finally, biochemistry and nutrients can change how your body transmits pain. Here are some of the things that turn down the volume. Okay, so we'll talk more about these, but these are places where a person can actually do things to help themselves. So there's pain transmission, and then there's pain generators. Pain generators can be things like bones and joints and muscles and nerves and connective tissue and bursa, things that can get injured or inflamed or torn that can generate pain. But in that same motor system of your body, all your muscles, bones, joints, nerves, and all of the system that controls it, you can have secondary sources of pain. What I mean by secondary sources of pain is you just start with pain in your hand, And then that can potentially affect the reflexes, the way your body would normally protect itself. And that's part of what can result in or influence things like myofascial pain, where you start to get pain spreading to different parts of the body, where you start to get patterns of muscular contraction that themselves become painful. You can get distortions in your connective tissue or fascial map that generate pain in other parts of your body. Here's just sort of like, okay, everything's connected to everything else. Your body is one unit. And so your fascial system, your myofascial system, which we can't really measure with MRI scans, but we can sense it and work with it hands-on. And anatomic studies show us how things are connected, and your fascia and connective tissue transmits pain. It transmits force. It's a major issue that can affect pain. And that's something that's really important to think about if you have chronic pain. The other aspect of propagating pain is the way it affects various biochemical systems in your body, especially your gut-brain immune complex or axis. This is really one system, right? But research in the past 20 years is showing us such profound connections between stress, emotion, belief, the health of your gastrointestinal system, including your biome, which you've probably heard of, all the bacteria that live in there, and then what's happening with the immune system in your gut and the barrier function of your gut, and how changes here can instantly affect your immune system and create systemic and brain inflammation that can not only increase chronic pain, but can result in a whole bunch of different symptoms and chronic illnesses that are driven through this vicious cycle of complication that can be triggered by acute or chronic pain, or can feed into acute and chronic pain. And so your mind-body system is one aspect of that. And pain is intimately connected with your emotional distress and your pain beliefs. It's a cycle. The two affect each other, sometimes more one than the other, but pay attention. You might see this in your life. Pain modulates emotional experience modulates pain. Well demonstrated, and there's things that you can do to work with that. So you've got this very complicated system where you've got a lot of different factors that are all related to each other, that are connected to each other, and they can drive the cycle that worsens chronic pain, worsens disability, worsens the way you feel about yourself, worsens your ability to connect to life and the things you care about in a sense of purpose. And ultimately, that's the worst suffering, is losing your sense of who you are and what you care about. And that's what I see in so many people with chronic pain. So all these different factors are kind of like something that flows downstream over time. It's vicious cycles that connect with each other so that as the years pass or the months pass, a person can get worse and worse to varying degrees. And, you know, most of these things are important with people with chronic pain. When someone develops fibromyalgia, it's typically a conflagration, all of this, that just kind of explodes out of control, sometimes slowly over time. But what we do in functional medicine is we try to start reversing these things. So, complicated picture, I like to simplify it, right? 3 realms, 3 M's, your mind-body system, your movement system, your metabolic system. And these are things that we can work on with various lifestyle and fairly safe interventions that are kind of natural stuff that's really about helping your body heal. In the world of your movement mechanical system, there's stuff you can do yourself. Movement is medicine. It affects so much: hormones, inflammation, sleep, pain, neurotransmitters. And there's different kinds of movement. There's this typical stuff you do at a gym or in physical therapy, but then there's mindful movement, which is more gentle and meditative, like yoga, tai chi, qigong, Alexander technique, Feldenkrais method, Pilates fits in here. And some of these things are better than others depending on you, what your sort of personality is like, and what your pain is doing to you. Then there's things that you have done to you that are mechanical or structural. Physical, energetic treatments. Things like acupuncture, manual medicine, osteopathy, physical therapy, massage, Reiki. Other aspects that are getting a treatment. In my experience, a combination of things done to you and things you do to yourself are what tends to help a person the most in terms of getting themselves moving and functional again. Then we talked about biochemical metabolic issues. You know, your diet, the foods you're sensitive to, nutrients, eating a high antioxidant diet, tuning up the adrenal and thyroid for some people where these things get out of balance. There's a medication called LDN, or low dose naltrexone, that actually stimulates your body to produce its own pain blocking chemicals and also reduces inflammation and immune imbalances that can go along with chronic pain that many people find very helpful. There's working on sort of nutrients that can actually help stress and sleep, and of course helping your gut heal and reducing that sort of pro-inflammatory immune dysregulating process. And then finally, your mind-body system. Part of it can just be having someone who understands you and can help acknowledge what's going on for you as real and help you start to find ways of getting out of it. And being aware of your own patterns and your pain triggers and your emotional triggers. Learning simple relaxation techniques can start to unwind those vicious cycles. Deeper practices like training mindfulness and spirituality, visual imagery, therapeutic dialogue, deeper psychotherapeutic practices that can help unwind the nerve, muscle, bone pain reactivity that many people have. And then healing trauma. It's workable. There are tools for healing trauma. We know that trauma drives chronic pain. So these are some of the things that I work on with my patients. I take a big view. I try to diagnose what amongst all these complex mind-body, biochemical, structural processes might be out of balance. And I come up with a plan that's customized, that's individualized, that is according to, well, what's best from a clinical point of view, who are you and what do you care about and what are your values like, what are you interested in, and what is available to you, what kind of resources do you have. And I'm happy to work with my clients since I do a lot of telemedicine. I frequently do that and help them find practitioners, help them know what to look for if they're going to get some kind of body work or exercise training or acupuncture or what have you. A lot of this we can do by telemedicine. And so that's how I work. And if that seems appealing to you, make an appointment either by telemedicine or in person where my office is. And I'll be happy to do my best to help you out. Thanks a lot for watching.